everybody, and welcome to another episode of Cuppa Tea with the Vet. Got your cup, Ben?
Good day. Good evening.
Hello. This is Ben Gamsa, and he is joining us from Cotswold Vets this evening. So, Ben, introduce yourself.
Well, hello. My name's Ben. I'm one of the vets here with co-directing with my wife Anna. We're a little practice in the Cotswolds between Swindon and Cirencester that started about 6-7 years ago, and now in the dizzy heights of 20 staff members and all the fun that goes with it. So small practice, and subsequently do a lot of varied work, from routines to more exciting stuff. And have the pleasure of working with Donna as well, of course.
Thank you very much. Yes. Yeah, I mean, your practice is actually quite amazing. So it's, did you actually start it out, or did you take it over from somebody else? Because it's quite big and posh.
No, well, yeah, we very much started from scratch. It was just my wife and I, two vet nurses, and just grown organically. We didn't really know anyone in the area, so we actually came from Banbury before, and we're working there collectively for about 12 years, and just decided we wanted to sort of start on our own 2 feet, and the rest is history, as they say.
Oh, good for you. Well, you've done a great job of setting up. I mean, certainly your clients are so completely in love with you. Obviously I see a lot of your patients, and I'm so thrilled when, vets when the owners have got nothing but good things to say about their vets. It's lovely to see a vet who's, so supported and so loved as well. So, so well done to you for doing that. That's great.
Thank you, Donna. Ditto. So all good.
Thank you. So yeah, if you are a client out there of Ben's, and come along and tell us your stories about him. I'd love to hear some more about him. Yeah, hopefully I'll have some nitty gritty. That would be really cool. But yeah, no, it'd be lovely to hear your stories of, what's he done for your animals, because it's just so great to hear. Hopefully Gemma will come along and come and say something at some point, because she's one of our mutual clients, and I know she's always got good things to say. And I always say to her, oh, you should think about going to work back there, because she's a nurse as well, which makes me laugh. So yeah, we have lovely stories. So David has popped on and said, evening all. Hi, David. Thanks for coming along and saying hello. That's really good. We love hearing interactions. So we want to know more about you, Ben. So what do you like to do in your spare time?
I guess what little I've got, looking after the 2 little kids. We've got 2 and a 4-year-old, which are clearly the joys of our lives. And apart from that, I guess hobby-wise, I get a bit of chance for some cycling nowadays. That's pretty much it, is the best way to phrase it. But certainly, well, actually, we bought a little camper van at the end of last year, so that's quite exciting as well.
That's amazing. I love a camper van. I really want one too. I'm jealous.
Pop away for the weekend. Yeah, it's about as impromptu as you can get. If we manage to get away at any sensible time and just disappear for the weekend somewhere fun with a family. But yeah, no, cycling and I think probably work, pretty much work and family take the most of my life up.
You have to go to the Isle of Wight. It's my favourite place in the whole planet. I mean, I say that like I've been to the whole planet. I haven't.
It is lovely. In fairness, my family home is a little place called Branscore, which is in the New Forest, so between Southampton and Bournemouth. So Isle of Wight's not a million miles away. I used to pop down there every so often, and it is a lovely place.
Awesome. So I did see on your bio, because obviously you did some stalking, obviously, as you do, and I saw you played the sax. That is so cool. How good are you? I wish you had it right now to play.
Previous life, not any good anymore, is the best way to phrase it. And that's always the case when you I think you look back at all the things you used to do, and when you had time to do them, don't you, and think, oh, actually, I used to be half all right there. But yeah, I guess in my heyday, so to speak, I played in a little jazz band, and used to do a few gigs in local pubs and various bits like that were blues and jazz and that sort of thing. But yeah, certainly not picked it up any time recently, and certainly if I have, it doesn't sound anything like it used to. So.
That is so cool. I want to put a little challenge to you to do a little recording of your sax playing and post it on my Facebook page, because Oh, I just love it. I really do love it. I was so moved by, this is where I go all TV on it, but Britain's Got Talent had that amazing saxophone player, and I was that audience member that cried at it. I was just like, oh my God. And I'd love to play the sax. And I've got a young daughter too. And so we went to one of these open days they had for the local school that does loads of music teaching. And they had all these different instruments to try out. And I tried the sax. Oh my God, I could barely blow a noise on it. I was so embarrassed. I was like, this is so hard. I had no idea it could be so hard. So yeah, you should be very proud of that. We've got some interactions from everybody as well. So the lovely Michelle, who I love to bits, she's actually a vet nurse, and she's in Australia. She should be asleep right now, but she's on here anyway. And she says, hello from Western Australia, lovely lady. She means that to you as well. Brian says, love the Isle of Wight. Well, of course. And Michelle, the reason why I had to put this in there is because she's also said, God damn, I love the sax. So there you go. You've got a lot of fans out there. So yeah, I think we all need to hear more sax in our life. And also, I did also see that you had run a marathon. Is that right?
Well, yeah, that was a few years ago now as well. Showing my age, that was 2005. So I suppose, yeah, 15 years ago. But yeah, it was something I always wanted to do. And trying to get into the London Marathon is difficult at best. If anyone's ever tried out there, you kind of end up having to apply year on year. I just was lucky enough to subsequently get a place and yeah, ran for Guide Dogs for the Blind and did the usual. I've never run a marathon before. I'll run the first half in a ridiculously quick time and then pretty much hit the wall and crawled across the finish line. But I made it nonetheless.
I have to say, the reason why I brought it up is because I am still shocked how many veterinary professionals have run a marathon. I'm shocked how many of these interviews I've done with people that have run marathons, and I've done one myself as well. And only a couple of years after you did, I noticed. So I was like, that is too weird. But then I think, well, 36,000 people did it the year I did, so maybe I shouldn't be so shocked.
I think we could probably put a shout out to Brian Faulkner at the minute running for Street Vet, and he's just finished 31 marathons in 31 days, isn't he? So it's I wound him up and said that he's what crazy next adventure is he going to do? He said he's going to pass the baton to me instead, so I'll have to think of something exciting.
You know him then?
Oh yeah, he's a sort of colleague and a friend, I suppose, is the best way to phrase it.
Oh, lovely. Because I saw his story and I was like, wow, that's amazing. But obviously I don't know who he is at all. So other than that, he's a vet. So yeah, amazing.
Yeah, it was his 50th on Monday as well. So happy birthday, Brian.
Oh, wow. Definitely happy birthday. That's amazing. So we've also got more interactions. Matthew has come on and said, hi, Donna and Ben, watching you. Thank you. Hi, Matthew. And Michelle, she's also said why she's awake in Australia. Her daughter woke her up. Bless her. Those joys. And she says, yes, hello to Ben. And Anna, which I'm assuming is your wife.
Indeed.
Hi, Anna. She says, hi from Molly, Jack and wifey. Oh, that's lovely. Well, make sure you ask some questions too, Anna.
I hope not. She was an expert violinist in her time, so I must admit both of us have let the ball slip with our musical talents, so to speak. But
that's amazing. But now you get to pass the baton on to your kids.
That's it, exactly. Get to hear them playing the strings badly or blowing the saxophone and out of tune.
It's all right. Just do it from down the garden. It's all fine. I'm teaching my daughter piano at the moment, but I'm not good at it either. But she's only just taken to the idea of doing it. She's 6, so that's fair enough. And I'm just like, oh, it's so lovely. So I'm hoping that she'll be amazing and I can take her down Canary Wharf to play on that. Is it Platform 88, the piano? They have a public piano. If you can go to Canary Wharf, just go, and it's just incredible. Yeah, blew my mind when I went and watched these amazing people that just rock up in their business suits. They clearly just had a day at, I don't know, PJ Morgan or whatever, and then they just start playing this piano, and you're just like, what? But it's incredible, and it's all for free, so it's all good. Yeah. So, what made you decide to become a vet?
Oh, the $1,000,000 question. I must admit, I don't quite have the exciting story my wife does, that it's something she always wanted to do and never dream of doing anything else. And bless her, would never subsequently choose to do anything else. I think I've always had a passion for animals, and I had something that I enjoyed doing was, sciences at school, etc. And decided that got to an age where 14, 15, sort of was umming and ahhing between going into the medical world, becoming a vet, doing something different, becoming a lawyer, and really felt that veterinary had the greatest combination of passion for animals and people that I could bring together and sort of deal with on a day-to-day basis. And so pursued that career dream, and always had pets as a youngster. And that's really where it all came from. I can't claim to have some exciting farm background or having had 28 horses in my backyard, but in the same vein, we had a rabbit, a guinea pig, and a dog and a cat. So, I guess a pretty standard family in that respect.
To be honest, it's great hearing everybody's individual journey anyway, because like you say, it's not about, not everybody comes from exactly the same background and ends up in their veterinary world. And it's really nice hearing the different routes as well. One of my guests, she had no intention of being a vet to start with at all, and actually ended up doing a completely odd random office job and joined it later. And it was a really nice story, because I was like, wow, you can't even imagine that pathway going, can you? But she knew she was on the wrong path and then got on the right one. So, it's great to hear those things. And also what's really good to touch on there is the fact that you said this is a great way of working with both humans and animals. And because I think that's really important, and it shouldn't be missed, because it is a huge amount to do with people, isn't it? As much as you think, oh, well, you're just looking after the animals all day, you've got to care about how the owner feels about that as well, don't you?
100%. Yeah, I think if you don't enjoy dealing with people, then you're in the wrong job, really. But that's a game. How did you end up doing what you're doing? It's the same sort of passion, really, isn't it? People and animals.
Absolutely. And for me, it was always going to be working with animals. But you end up on a journey, don't you? You don't really necessarily start knowing, oh, this is exactly where I'm going. I never knew that I would be able to be a physio in the end, but I started out as a nurse, and this was the route I took, and I'm so pleased about it. So it's lovely seeing how those journeys are.
I think when you're young as well, there's all this pressure to decide what you want to be, what you want to do, and somehow you get to 18, 21, whatever the age might be, that you've kind of come to the end of your educational career with whatever qualifications you've got, and feel that somehow you ought to know what you want to be and what you want to do. But for a lot of people, it takes their entire life to find the career that suits them best. And I think that, as you say, that morphs along the way, really, doesn't it? And
definitely
not knowing exactly what you want to do or where you want to be when you're kind of late teens, early 20s is quite okay. Everyone.
Exactly. You can end up having so many different doors out of it that you never saw coming either. And you need to go and work as a careers advisor, Ben. Help out. So Michelle has put a laughing face on. That was for ages ago when we were talking about all of our music. And she's also pointed out that Ava, her child, loves to drum. Well, drumming's the best. That is so... I must admit, I'm a proper hippie at heart, and I like going out to these wild places, and the African drumming and the Japanese drumming. Oh my God, I saw a show on Japanese drumming. Not going to lie, ladies, if you want to see some seriously amazing things, go and watch Japanese drumming, because it's perfectly legitimate to stare at those bodies. It's amazing. They work hard. I've never seen anything like it. It was incredible. And she's also, Michelle's also said, so true about our discussions about the careers. So fantastic. So what's your favorite part of being a vet?
I think the variety, really. I've always said that I think I get bored doing the same operation every day, or the same subspecialism. And in the human world, as a surgeon, it's kind of, you're either a knee surgeon or you're shoulder surgeon, or whatever the situation might be. And much as for some people that specialization is exactly what they want, and that they gain great comfort and satisfaction from the fact that they're the top of their field in a certain area. I've never really wanted to do the same thing every day, and it's that variety that even within a specific section of veterinary, be it smallies, equine farm work, it still has a massive day-to-day variety and a difference in terms of what the day hits you with, shall we say. We don't always look forward to that in not knowing quite how crazy the day is going to be, but in the same vein, it's that plethora of different problems and people that make our lives exciting, and really why the past few months has been difficult for some to cope with, because I think they've forgotten quite how much they draw off of clients in client interactions and client satisfaction and those rapport that you actually have with people on a personal level that you just can't replicate from a phone conversation. No,
totally true. I must admit that's been my biggest struggle, has been not having the clients around you is actually harder than you think, isn't it? And not being able to communicate in the way you feel comfortable with and that you've learned for all this time. And yeah, I definitely agree on the variety of work. I mean, one of the most amazing things is how much you've constantly got to keep up your training and your learning, because it's always changing, always evolving, and there's so much to know about everything, isn't there?
Well, that's it. You could spend your life pushing into one area, but trying to stay on top of all different elements of even one aspect of veterinary work is difficult nowadays. But I guess that's why you don't truly see many sort of James Herriot's out there in the same way that we used to. You think, I think my wife was watching All Creatures Great and Small yesterday as a sort of backtrack, writing up clinical notes, and it makes you realise, even if we rewind 20 years, quite how different things were from a veterinary standpoint. And it's changed quite significantly, hopefully mostly for the better, but certainly has changed a lot in terms of that job role. Definitely
agree. It's a lot of change in the last 20 years. I've been in it nearly all 20 years, so yeah, that's quite scary. Just made me realise that. So what pets have you got?
We've got a little doggy, little cocker spaniel, and two little pussy cats that various waifs and strays that we've picked up along the way. Can't claim that Poppy is, in fairness, but the cats are waifs and strays. So.
Oh, lovely. No, that's lovely. Yeah, you can't help but pick up some when you're a vet, can you? There's always something you're like, oh, that's cute, I'm taking it home.
That's it. Yeah, I've had my moments. I used to breed sugar gliders once upon a time, which were a bit of a strange pet to sort of own or be involved with. But that was back in the days of university. So it's lots changed since then.
Blimey, that's amazing. Yeah. So Michelle has also said, love this, Donna, and she has I hope I can say this right, a djembe drum. So yeah, that's awesome. I'm gonna have to look up what one of those actually is now and look for a photo. But that's very cool. Drums are just the best. So a question I love: what part of being a vet still grosses you out? There's got to be something.
Well, I think probably a topical favourite has always got to be the accidental anal gland expression into your mouth. That's never good, really, is it? Let's be honest. I don't think genuinely there's anything else from a small animal perspective that is truly gross. I think I'm not the biggest fan of colonoscopy.
Fair enough.
But I'd say, yeah, apart from that, that's pretty much it, really. It's
you've got a good constitution then. I'm quite impressed. I mean, stuff just grosses you out. Do you know, one of my clients showed me literally yesterday, her dog has got the weirdest thing. It's like one of the bones hasn't formed in its tail. So there's bone, gap, and it's about that big. Bone. It's huge. And the tail just flops around. She said, here, look, Donna, feel that. And I was like, oh my God, that is so gross. And it is literally disgusting. And there's nothing wrong with it. It's fine. It's just clearly the bone just, for some reason, it isn't there. And it's absolutely disgusting. So yeah, I'm still finding that there's things that will gross me out when I didn't even know. We get sensitive. Michelle has clarified that it is an African drum. So yes, awesome. Love those things. So what would your dream achievement be if time was no issue?
Oh, that's a big question as well, isn't it?
Yeah.
I've always had a bit of a strange desire to go to space. So I think if I could sort of do it as a bit of a sideline, I'd go and train to be an astronaut and subsequently go on some veterinary related space mission.
Well, so you've got to go find an alien that you want to treat.
Well, funnily enough, I do know that there are vets that have become astronauts. There's not very many of them, but yeah, it's the sort of thing that very, very bizarre. Certainly not the right area of the world to be in to be pursuing that sort of dream. But I think time no object. Clearly that's something you could do as a sideline. More serious things. I'd always like to be I'd quite like to do my PPLH, which is like a helicopter license, but clearly don't really have the time or the money. But that's again a bit of a dream for one day. No,
that's really cool. I like both of those. I mean, for the astronaut point of view, you have to tell me who it is that that's done that, because I need them on this show. And also, at the end of the day, they're making it so that like space travel is going to be so you can just pay for a ticket, which is just insane. So yeah, so it could actually happen, and that is really cool. So it's cool to have a dream like that. Helicopter license. I've got the best story ever. I haven't done this, but one of my clients was telling me, and I still can't believe this. He was doing his helicopter license thing, and so he was obviously in a lesson, and he took off. The wind came along and took the helicopter, and it went up sideways. Boom.
Oh dear. Sounds like an expensive mistake, isn't it?
Yes, it really was. I still can't believe that. I didn't know those sorts of things were even possible. So I'm just saying, maybe that's not the best pipe dream ever, because that put me right off. That said, my cousin is actually a helicopter pilot. So he flies them all over the place because he did the RAF and stuff. So anyway, so there are also lots of safe stories because he's never had any trouble. But yeah, it's I think that's a pretty dodgy one. Anna might be watching this thinking, no, you're not allowed to fly a helicopter. Stop it. Stay at home.
What about your pipe dream, Donna? You must have a time no object. I'd like to do that if I
have like a million of them. Absolutely a million of them. Oh God, I have so many of them. It's just absolutely crazy. But yeah, mine are probably where my work obsession come out. I would really love to do a PhD. Would really, really love to do that. So yeah, that's one thing that would.
No time like the present.
Absolutely. And so yeah, one day, but yeah, oh my God, it would just be absolutely insane. And yeah, it's yeah, can't tell you enough how much I would want to do that. It would be very cool. So Brian has also said, our daughter Paige would like to know what the most exotic animal you've treated was.
Oh wow. I suppose we treated some kangaroo joeys in Australia. I've amputated a monitor lizard's toe. I think, yeah, my wife did a nephrectomy on a snake.
Oh, wow.
So, yeah, that little one had to have its kidney out. I guess from an orthopedic standpoint, I once had a double yellow-headed Amazon that needed to have a type 2 titanium external fixator because it had a broken tibia tarsus. So that was an ongoing game for a parrot with a broken leg, if you like. What else in terms of exotics? Well, I guess I nursed my own sugar gliders. One of them had a broken leg, which was interesting. Aside from that, I guess nothing overly wild, although I must admit one story that does come to mind, and this wasn't really my own, but I was there as a sort of vet student at the time, was treating a tiger in Marwell Zoo that's jumped at the cage bars. We were kind of going to try and help it to get into its transport box, if you like, and they have massive like cage fronts that are on rollers. And as the zookeeper and the vet in charge had taken the cage off the being fixed, if that makes sense, and were about to then push this cage in, the tiger leapt at the actual cage and almost pushed the entire door off the rollers towards us, if that makes sense. And it literally sort of rock pivoted and then went back in. So we're very close to being eaten by a tiger, I suppose, is the most exciting story I suppose I've got.
That is very scary. Someone's actually popped up crying face. So yeah, I think that, yeah, that is a very scary story. And I mean, what an amazing situation to be in, to be able to be in that situation. But on the flip side, yeah, also insanely scary at the same time. So yeah, your emotions must have been all over the place.
Well, I guess at the time you don't really clock it in quite the same way that you do afterwards, do you? Kind of having a bit of an adrenaline rush and do what you can to get out of the way. But realistically, I think in those sorts of situations, if you've got a big cat that's loose, there's not a lot you're going to do about it, let's be honest.
True, that is true. And the thing is, you can end up with these dangerous situations all the time, can't you? I mean, another Isle of Wight story. We were at Garlic Farm, funnily enough, and they've got loads of big, very big horned cows. I don't know what type they are or anything, but one of them escaped. And so the staff were all trying to catch it. And I volunteered to help because I was like, well, I've at least got some experience with this situation and you need help because otherwise you're not going to get this sorted. But when a big giant cow with her giant horns comes running at you, it's quite scary. So, you know, I was like trying to whip this like rope round to try and sort of scare it in another direction. But yeah, these things are, they are scary. And those situations can come from anything, can't they?
You didn't have the red flag in your pocket then?
No. I was very unprepared, obviously. But it was, the poor thing had been mooing for ages. She was actually really scared because she just managed to get out of the field on accident and lost her friend. So, you can't help but be sad for them as well. It's like, poor thing. So Paige says that's pretty cool to your story, by the way. She thinks those exotics were amazing. And Michelle's laughing her head off. So, which makes a lot of sense. So, if you could be amazing at any sport, what would it be?
Oh, I guess when I was younger, I always would have loved to have been a professional footballer. Just clearly didn't have the talent. But it's funny, isn't it? I think you kind of kid yourself that if you spent enough hours doing one thing, I can't remember what the statistic is, something like 10,000 hours or something, isn't it? If you've done 10,000 hours of whatever it is, you're probably almost as good as you're ever going to be at that individual thing. And I think, nowadays you get a bit older and you think, well, maybe I could be a cyclist. Maybe I could, if I put all the time and the hours into it, maybe I'd be sort of half decent. And I think probably it's because of when you start staring late 30s and early 40s, you start re-questioning what you actually could be any good at. Because ultimately, if I was a professional footballer, I think my career would be over before I've even started. So, I think I'll stick with cycling for now, I think.
Awesome. I didn't know that 10,000 hours thing. That's pretty interesting. But no, that is, that's very, there's a lot to think about there. Because now you're just thinking, well, I've got to clock up the hours and work out what you've actually done. Because that's a lot of hours.
Well, it's like all these things. I think if you start a sport when you're young enough, you can become insanely good at it before you reach a sort of serious age. I mean, one of my best friends at school, actually, a chap called Cloudy Console, was an incredibly good golfer. And I think he started so young that he'd put all of those hours in, and it's before he was a teenager, if you know what I mean. And clearly by the time he was 17 or so, winning, amateur internationals and various other bits and bobs. But it doesn't matter if it's a musical instrument or a sport or whatever. It's often, don't get me wrong, there's a lot of hand-eye coordination and a lot of things that are sort of prerequisite, but a lot of it is just practice, isn't it? And keep going.
Yeah, I do. It's a lot of understanding as well, but also just to be a motivation to anyone who wants to start later in life, because there's never a reason to give up. I do gymnastics, and I have been better as a gymnast as an adult than I ever was as a child. And I've achieved more as an adult gymnast than I ever did as a child. And I can only put it down to the fact that I can think and understand now my body. But the best story I have is this lady called Dorothy, who I used to go to gymnastics with, and I absolutely idolise her, and I hope to be her one day, because she didn't even start gymnastics till she was 56. That's insane, isn't it? And I did my veterans gymnastics competitions with her. She was 80.
Oh, epic.
Yeah.
Yeah, it's like when I ran the marathon, I got overtaken by people that are 80, and you think, okay, that's pretty insane how you're still doing that, and you're
Some
quick.
people are incredible. Amazing.
Yeah,
oh, bless.
Got the desire to do it. There's always the time. That's the best way to phrase it.
Absolutely, absolutely. So, if you could have a Facebook live chat with anybody, dead or alive, who would it be?
Oh, I think I'd have to say my granddad. I'm not very good at famous people, is the best way to phrase it. So I think idolizing people specifically, it's never really been my penchant, I suppose. I guess why my granddad? He died when I was very young. I guess I was 2 at the time, and I've always thought of him as quite an inspirational figure. He kind of lost his leg in the war in World War II in Malta, and when he was in the army, he was a champion boxer, and just a number of the things that he did with one leg and one stump, playing football, cricket, things where he actually never even let on to those around him that he had a fake leg, if that makes sense, and they didn't know. And I'm talking above the knee, it's not a kind of, you wouldn't notice because it was a sort of peripheral limb type situation. I think he was no doubt quite an inspirational chap. It would just be nice to have actually had the chance to discuss things with him in more detail and learn about all his various medals and bits and bobs that you don't really get much of a chance to when you don't get to know your grandparents. But very lucky to have had the chance to get to know a number of my family, which of course a lot of people don't have the opportunity to. But what about yourself?
Well, I was just going to say that is an amazing answer, and I really love that, because yes, I mean, I'm not particularly celebrity orientated either, but I mean, oh God, I'd love to talk to the Queen, in all honesty. But that's going alongside the fact that it's talking to older people is actually amazing, isn't it? You hear such amazing stories from them, what they've gone through. You can't even imagine, you can't begin to imagine half the time. And there's an old lady, Queenie, that me and my family used to go and visit a lot, and she died fairly recently, but the story she used to tell us about Bletchley and the stuff she did in the war and all that sort of thing, you look back, you think, how? And my granddad wouldn't talk about the war stuff or anything because he was so heavily affected by it, which is again understandable, but you learn so much from these people about resilience and coping and dealing with literally nothing in your pocket. I'm really like watching all these old programs, well, not old programs, but programs about the old days. Michael Mosley, he's actually, I'd love to talk to him because he's pretty cool. He's a doctor and does loads of documentaries, and he did one on Victorian living and slums. And oh my God, how people lived in Victorian slums was beyond me. And then to find out that most of those slums were owned by the church and by the Crown estate and things, I was like, whoa, there was just, it's unbelievable, isn't it? So yeah, I think that's great. Talking to old people is just amazing. I hope somebody finds me amazing when I'm old and wants to talk. And yeah, otherwise I'll be like, oi, why won't you talk to me?
I think we don't make the time to listen, neither do we. I'm just as guilty as everyone else. It's always here now and get on with the things you've got to do, and you kind of head down, get on, don't you? But actually, you learn nothing from talking to people or talking at people. You kind of learn the most from listening to other people's stories and situations. And
absolutely. Michelle has said very inspirational. That was over the talks we had about the sports and joining sport late. And she's also said that's lovely, Ben, and that was about you talking to your granddad. So thank you for that, Michelle. That's really kind of you to say. So also, Ben, I really want to know, can you tell us something that nobody knows about you?
Oh, crikey. Before the watershed as well. We're in trouble now. What nobody knows about me.
Or Anna, just add something in the comments yourself.
I'm a pretty open book. The problem is, if you speak to anyone around here, I wear my heart on my sleeve. So it's, you know, if I'm happy, sad, angry, or somewhere in between, because it just all comes out. And I'd say to you that there's very little that's in my, shall we say, dark locker that's hidden away with a combination lock that even I've, you know, purposefully forgotten. But what does no one know about me? Let's have a think. I was head chorister when I was at school.
Oh, wow. Is that singing?
Yeah, bit of a bizarre one. I would say to you that clearly in the years before my voice broke, but that was something that singing a solo at Winchester Cathedral was probably a highlight of my singing career.
Wow, that's amazing.
Sing for toffee anymore, then ultimately it seems like a distant memory, but it's something my mum would be proud of, and at some stage she'd sort of bring out some horrific photo that I pretend wasn't me, you know, sort of usual situation.
Wow, that's amazing. That's a good story. So well done managing to find that in your archives. Well done. So what's the most spontaneous thing you've ever done?
Oh, well, I guess probably going off traveling, really. Anna and I, my granddad, other granddad, shall we say, sadly passed away when I was, well, when are we talking now? 2012, so, you know, 8 years ago, and left a few pennies that I sort of had the discussion as to, do I buy a car or do we kind of use it as a fund to go traveling together? And Anna and I decided that we'd leave our jobs, disappear into the big wide world, and sort of do things that we never had the opportunity to do, you know, pre or post university in quite the same way. So we sort of went traveling for 12 months and went to 13 different countries, carried on east and worked our way all the way around, and worked in Australia and charity clinic in the Cook Islands and various places that we visited in between. That was, yeah, a pretty amazing journey, really, is the best way to phrase it, and something that we'll always fondly look back on and take everything else away from me, so to speak, and I'll still have that. So.
Wow, that's amazing. I think that, yeah, winner. Well done. That's absolutely fantastic. Spontaneous thing. I mean, that's big. That's not small. So yeah, well done. That's very cool. Michelle also says that's awesome. Probably because you said Australia and she's in Australia.
It's definitely a lovely place. Yeah.
So tell us more about your clinic. You know, what's the amazing fangled-angled things you've got that you can tell us about with your clinic, and amazing staff you've got and all that sort of thing?
Well, it's mostly run on amazing staff, I think, is the best way to phrase it. I think the gadgets are fun, but they come with getting slightly bigger. Yeah, I guess we've always been a family-run kind of independent, and everyone that we've had the pleasure of taking on, you know, at various interview stages, we would wholeheartedly employ again. And they're all part of our extended family, really. So we've got a number of vets and nurses that are all extremely competent and qualified at doing what they do, and lots of them with different interest areas in various elements of small animal medicine, surgery, dentistry, cardiology, whatever it may be. So that's kind of pushed us to try and offer the best kind of service sub-referral level that can still be achieved within a general practice without having to send patients here, there and everywhere as soon as something gets even remotely complicated. So gadget-wise, yeah, well, I suppose a few years back, we bought a whole kind of endoscopy suite that allows us to do everything from looking in bladders to joints to laparoscopic liver biopsies and various bits in between. We're just in process of trying to buy ourselves a fan-angled ultrasound machine to replace our, shall we say, more mediocre unit that we've had since we bought that is perfectly, good for small animal abdominal imaging and kind of heart scans. But we just feel we've got a team that have more specific interests and want to push that in different ways. What other fun gadgets have we got? Cryotherapy, a bit different. Not every practice has it, but that comes in handy every so often.
Nice.
Yeah, that's pretty much its height of excitement for us. I think we're not big enough for things like CT scanners at the minute, and we've got plenty of options for outpatient referrals. So
no, I think that makes sense. That makes sense. Use what's around you. And I think, to be honest, you had me at the staff are amazing, because I think that's the biggest thing that you can have is amazing staff. And once you've got a lovely receptionist to greet you on the way in, then you're already winning. So well done. A happy team is definitely the most supportive thing that you can have. So and what do you love about physio?
Oh, where do I start, Donna? I think it's just a great tool to add to the mix of what and how we can offer for pets rehabilitative care in particular. But also, I'm fully aware of the fact as vets or as doctors, you go and see someone with a problem yourself. And I only say it like that because it's easier to quantify, what the problem is. And they may well say that your leg's not broken and it's not hanging off, and it's subsequently you ought to go and take some ibuprofen or whatever it is that they tell you to go and do. But, let's be honest, it's not the be all and end all of musculoskeletal issues. And I think there's plenty of realm for picking up portions that we don't have the expertise, the shall we say, teaching, time, inclination, mix of it all really to be able to help with. And it's lovely that can be done by someone like yourself that has the time and dedication to pursue that in a way that we would never be able to from a veterinary standpoint.
Thank you very much. Yes, that is a very nice overview. So thank you. And it's great to have your support. So most appreciated. So Michelle also has said traveling is the shiz anywhere in the world. That's how I met Michelle, was because she came over to the UK and she loves traveling. Mandy, thank you so much for joining us. She says, we've enjoyed listening to you both, but have to say goodbye now. Ben, Anna, and their amazing work family are truly the best vets ever in our eyes, and the pack are truly grateful to be looked after by them. From Mandy. So thank you, Mandy. That was really kind of you to say. So really appreciate you coming on and saying something. So yes, that's awesome. So also, guys that are watching, it is also Pain Awareness Month this month. So if you have any questions about pain, and I should have said this ages ago, do feel free to ask any questions. But we're obviously going to keep chatting. But yeah, do come along and ask some questions. Because if it's a big subject, pain, it's not nice, and it's something we all want to deal with. Certainly my huge passion. And that's ultimately why we're here. Most of our job is to get rid of pain and do our best with pain, isn't it, Ben? So
indeed, yeah.
So yeah. And
no comment, just calling me a pain. That's something that we'll say for afterwards.
That is fair enough. That is fair enough. So what's the weirdest dream you've ever had?
Oh, well, there's plenty on that tack. I think recurring dreams, it's the sort of thing that you have when you're younger, don't you? I remember I always used to have this sort of dream where I'd gone to school and I was in a toilet cubicle and suddenly I didn't have any trousers, and subsequently didn't know what to do, where to go. And I guess that was probably a sort of partial anxiety related being at school type situation. And I always quite like the ones where you fall off the top of a building. I mean, I've always had that where you jump or you fall, but you always wake up before you hit the ground. I used to have those quite a lot. I think particularly as I was going to sleep, and then you'd sort of go like that, wake yourself up again and think, what just happened? But yeah, I think that Freud would have a real sort of exciting time with my nighttime brain activity, I'm sure.
No, that's cool. That's why I like asking the question, because it's always nice hearing that other people have got bonkers dreams too. Sorry?
What's your best or craziest?
Oh God, I've got so many, and some of them are really scary. But yeah, I've been chased by flying piranhas. I've been sat like a little gnome in a river. I've been roundabouts. God, I've had roundabouts where I just keep going round and round, and as I was going round them, they were getting more and more upright, and in the end I was like nearly falling off of it. Oh God, that was horrible. And then I've had awful animal related ones that I just don't even want to repeat, because everybody will be like, oh my God, she's actually lost the plot. And I swear that I've had a lot of nightmares as well, but I swear a lot of it was because where I used to be a night nurse, it really messes with your sleep. And so your head goes into crazy la la land when it tries to sleep in the day. So yeah, I definitely think that Freud could have a field day with my brain as well. So yeah, I understand. Michelle's laughing her head off again, and she says, "You're so funny, Donna." Thanks, Michelle. I know, it freaks me out too.
Sounds like you're Dali paintings as well, are you, in terms of the old roundabouts coming up and changing into a vertical? So it's those weird ones with the melting clocks and all that sort of stuff. I think if I've got that right, probably haven't, but.
I don't know the name of those ones, but I know the ones you mean. I mean, to be honest, I think those are quite clever, aren't they? But so maybe that is why I have an affinity with them. Who knows? I'm almost worried to ask this question, because I think you're going to say it's an alien. But I was going to ask what if you could treat any animal in the world, like what would be your dream patient to treat? But I feel like you're going to say it's an alien.
Well, I don't know about aliens. They're a bit. I've been reading a lot of Smoos and Smeds with the kids at the minute, So I'd say if you've got that book, you know what I'm talking about. I think I've always had an affinity for big cats. I do quite like, tigers and snow leopards, and they definitely have a certain air that I don't think many other creatures kind of get near, I suppose. But probably a polar bear, just to be a bit different, would be a bit of a wild experience, wouldn't it?
That would be absolutely amazing, definitely. And you'll have to freeze whilst you're doing it, which would be a bit rubbish. Sorry?
Or a sperm whale, maybe like something you had to actively dive while subsequently dealing with it. I'm not quite sure how that would work.
Yeah. It's just like being freezing cold. That's just crazy. I mean, that's amazing. But I was just thinking, oh my God, so you're like the luckiest man in the world, because you were saying you like the big cats. And I was thinking, well, you've worked with a tiger, so you literally have found your dream there. That's pretty impressive.
Well, I think when I left university, I wanted to do exotics, and sort of did my university kind of, we had for like a 4-week block, you could choose what you wanted to do. And I did that at Edinburgh Zoo, and it was all about, everything from darting to dealing with highly exciting exotic species. But I think then you fast forward to sort of small animal practice, and it's either one of those you dedicate your life to do, and some of my friends and colleagues have done exactly that, and absolutely fair play to them, and therefore end up somewhere specific, just dealing with exotic pets or zoos or a combination of the two, or you find an interest elsewhere. And for me, surgery's kind of been that interest that then took over my love for exotic animals, if you like, and I've just pushed into that and enjoyed doing that in a way that changed my career path, and that's the way life goes sometimes. And I mean, in fairness, I always said if I was single when I left university, I was going to go and join the army and become a captain in the army. So would have just been dealing with dogs and horses, but it wasn't to be. So
no, but that's the thing. This is it's back on the career as a journey thing. So it's amazing that you found, ultimately you thought you knew what you wanted to do, but then you found something else that was even better. So that's really cool. So yeah, really good. Well done. So what's been the most memorable part of your career so far?
Wow. I think bizarrely working in that charity clinic in the Cook Islands and being the only vets, there, Anna and I at the time, and dealing with everything and anything that kind of got brought through the door was a bit of an eye-opener for island life, I guess, more so than veterinary work specifically. We had everything from a goat that had been attacked by a dog that we had to do a limb amputation on, all the way through to treating various orthopedic issues or dentistry that they had no dental kit for, and you think, well, back to kind of trying to either use a hammer and chisel type situation or leave it as it is. And you thought, well, okay, there are certain situations that actually you really go back to anything you've got, and very very different than clearly veterinary work in the UK, but just an eye opener, I suppose.
I do think veterinary around the world is actually a really interesting subject, because it does vary hugely. What resources people have got all over the place varies hugely. And, we're very lucky here, really, aren't we? And you just don't realise. And I've worked with quite a lot of vets from all over the world, and it is very different. You see what they're used to using is different, and not saying it's wrong, it's just different. It's very different takes on it all, and it's absolutely fascinating. They might have to try and get some vets from around the world on here as well, and talk the differences, because it is interesting. So that's really cool. And of course, island life, I mean, that's not even like it's just, oh, I'm on a small island. I mean, for the Americans would think we're on a small island anyway. But I more mean the fact that you're on a paradise island, weren't you? I mean, that's amazing.
It was something. I mean, I remember being paid with pizza vouchers. I mean, you say paid, clearly we weren't paid, but it was the sort of thing that one day we got left an entire sort of arm, I don't know what the right word for it is, of a banana tree. And, you think, crikey, there's so many fresh bananas here that I don't really know what to do with them. But, just random, if you like, donations of goodwill for our hard work, which was exciting in its own right.
That's very much more country life type stuff. My dad fixed someone's car the other day and got paid in a deer. Dead deer. It was literally like, that's what the guy does, so he just gave him half a body, I think it was, and it was all butchered and stuff. It was a very kind gift. It's just totally different and not what you expect. And my dad wouldn't do it for any money anyway, so he was very grateful. But it's just totally different, isn't it? But it's lovely. So that's really nice. So I have really enjoyed talking to you, Ben. It's been really lovely getting to know you, and so I want to hear from you, because we haven't had any questions about pain, but I really want to know, what is your top tip for pain?
Well, it's going to be a bit of a side swipe, I'm afraid, but I think top tip for pain is, we deal with a lot of osteoarthritis. Clearly, that's probably the most common issue that we see in middle to older age patients when we're dealing with how to deal with their pain. And I think what people don't always think about or realize from a small animal perspective is that they still say, clinically speaking, that the biggest difference you can make over time for trying to keep your dog or cat, comfortable, and or preventing, development of osteoarthritis, is weight control. So, you have to sort of discuss these things at every consultation, and it doesn't want to be a harp on as to your dog or cat is overweight, but it's just really, I think, people realizing that every other drug, pharmaceutical, nutraceutical aside, that is still the biggest factor that people can try and regulate and achieve themselves for ultimately no cost. I think we often in this country kind of kill our pets with kindness in the nicest possible way. We're all guilty of it. I don't look at one of my cats, he's a bit overweight as well, so I can't sit here and preach. But in the same vein, I think slimming them down to a sensible sort of body condition score is about the biggest thing you can possibly do to make a difference in the longer term.
Absolutely. I absolutely praise to you. That is absolutely one of the best things that you could say. And I know that any of my clients watching this will be like, oh, here she goes again, because I am considered the Hitler of body weight. I can't deny. I am like, come on. And but I am sympathetic as well, because like you say, we're all there. We all love our dogs. We all love our cats. We all want to give them lots of treats and stuff. And, my dog gained too much weight as well. And then I looked at him one day, I was like, oh my God, it's happened to me now. And I was like, oh God, I've got to deal with this. So I lost his weight, and it was, huge difference, straight away. And then, and just to add some facts to your statement, because I can't help but say all this, because I'm still blown away by the science that comes out from these studies. Just 6% body fat loss. So we're talking a teeny weeny bit. For a dog that's got 6% to lose is the equivalent of taking your non-steroidal anti-inflammatories every day. So that's basically a dog that's on Metacam can stop their Metacam if they just lose 6% body fat, or if they did then do their Metacam, it would be doing what it needs to do and not undoing what your fat's doing. So I hear you completely. It's
just
right.
For those that are on non-steroidals, please don't stop them because you've managed to lose your dog or cat that little bit of weight. but
no, absolutely. But that's the point, is that, you've lost that weight. Now the non-steroids are doing what they needed to do originally, and so they can have a better effect. So absolutely. It's just, those facts are just huge. And you're absolutely right. And I'm just standing by you and saying, well done, because that is like the best fact you could give as the number one top tip. So I'm really pleased. So thank you for that. So thank you.
Anna?
Sorry?
You've got a top tip for us of being in essence, a pain therapist. I feel like you could jump in here and give us a second top tip.
Well, your top tip is definitely the number one as well. So I am there. And then after that, it's definitely get some physio, because we can get, it's about mobilizing your joints, move it, use it or lose it is absolutely true. You've got to keep moving or you will lose your ability to keep moving. So so just don't stop, but in moderation. So there's always a caveat. So, you can't go for hours and hours anymore, but you can do it in a more sensible way that is good for the body and gets the circulation going, gets the endorphins going. There's a million things that can be done. And we could talk all day about it because I get excited. But it's lovely. So thank you. But Ben, you had the number one tip. That was the best one. And then the movements after that, and then the drugs are back on the scale down there, but they are needed as well when they're needed. So that's fantastic. So yes, thank you so much everyone for watching. It's been great. Ben, have you enjoyed yourself?
Very much so. Thank you for spending time with me this evening, Donna. Been a pleasure.
Awesome. Thanks for watching. Take care, and make sure you join us for our next cup of tea with a vet. And if you want to nominate your vet to come and join us, then please do message me and let me know who you want to be, and I will try and chase them and get them on here. Take care. Bye bye.